Glaucoma is an eye condition where the pressure inside your eye is too high. And by too high, I mean it's causing damage onto your optic nerve. Now, there may be several reasons why your pressure is too high. It can be because your eye is producing too much fluid and it can't drain quick enough, or it's producing the right amount of fluid, but the drainage system is compromised. Now, what actually happens is the pressure builds up to a certain level and then it presses onto your optic nerve. Now, you can imagine if you press on something, anything on your body for years and years without knowing, then eventually there will be an indentation. Now, the important thing to know about glaucoma is that you can't feel it. You can't think like, oh, my eye's paining, so that's why the pressure is higher. It's also referred to as the silent thief of sight. That's why it's important, especially if you're over the age of 40, to yearly check your pressure. Also, if you have a family history of someone with glaucoma, it's more important for you to regularly check the what we refer to as intraocular pressure. In order for us to detect it, to diagnose it, and to treat it, there's several things that needs to take place. The first and most common thing is to measure the intraocular pressure. That we measure daily, almost on every patient that comes for an examination. What we do is we put a local anesthetic drop in your eye. It numbs your eye for about 20 seconds. Doctor use what we call an applanation tonometer. It's not the one that you experience at an optometric practice where they blow a bit of air, like an air puff, into your eye. This is a contact tonometer, so it's more accurate, and it doesn't touch your eye. It touches the tear film of your eye, and that gives doctor an indication by he's adjusting it with prism so that he can actually get the exact pressure in your eye. The normal pressure is between 11 and 21. Now, even when you're on the higher end of the spectrum, we need to make sure that the pressure that we are measuring is low enough for your eye. So there's other things the doctor can look at as well in order to determine whether this is a normal pressure for your anatomy. The next thing that he'll do is he'll do what we call ophthalmoscopy. That is when he looks in your eye and he looks at your actual nerve. And he can see then whether it's been indented or whether it's a normal size with a normal contour and it looks healthy. In that case, it might be that even whether your pressure is on the higher end of the spectrum, it is still normal for your eye's anatomy. So let's assume that the pressure is too high. We measure 25, 26. Doctor looks into the back of your eye and he sees suspicious signs of your optic nerve being damaged. There's a few things that you then need to do on a regular basis. Doctor will always refer to treating glaucoma is that you need to establish trends. We need to do a certain thing now as a baseline reference, a few tests which I'll explain just now, and then we need to repeat them because we need to see, we can treat in the meantime, but we need to see is the pressure that we are lowering low enough in order to prevent damage on your optic nerve. Now, the first thing that we'll do after we suspect that you have glaucoma is to measure the thickness of your cornea. That is a test called pachymetry. It is in a case where you have a thicker cornea, we need to adjust the pressure. Because you can imagine a thicker cornea will be a bit more resistant. So we need to maybe subtract from our amount that we measured initially. If you have a thinner cornea, we might need to add to the pressure in order to get to an accurate number. The next thing that we want to do is we want to test the function of your nerve. Now, how it works is you have the optic nerve at the back, and that supplies your eye that connects your eye to your visual part of your brain. So we want to test the functionality of this nerve. The first signs that the pressure is too high and it's causing damage and your eye is not functioning to an optimal level is when you experience that your peripheral sight gets smaller and smaller. Now, we don't want you to notice that because peripheral sight that is lost cannot be reversed. So when you start to notice it, it's already been there for a while. So we want to have it here or in the normal range and then prevent it from damaging your peripheral vision. How do we measure that? It's actually quite a simple machine that we use. Not simple, but it's quite a boring test. What we do is we do it one eye at a time. I ask you to look into a machine. You have a small remote in your hand that it's approximately 5 minutes per eye. I'll put a patch onto your one eye and we'll ask you to look into the machine right towards the back at a light at the back of the machine. Now what you will do while looking at that light, other lights will flash. Some of them will be brighter than others and they will flash all around the show, but you are not allowed to look at them because we are testing your peripheral vision. If you look at them, we are testing your central vision, which is not what we want. We want you to look straight ahead, and every time that you see a light that flashed, you click the button. Approximately 5 minutes per eye. That will give us a printout of your actual visual field, and we will be able to see whether it's compromised or not. The next test that we need to do is what we call an OCT scan. It's an ocular tomography scan. So what we would then measure with that is the actual thickness of your optic nerve, the rim. So we'll be able then to see, is there any anatomical damage towards the size and the thickness of the circumreference basically of your optic nerve. We'll see if that indentation that I refer to, how deep it is. And that's a very accurate indication. If we remeasure 6 months down the line, we can, in numbers, not by doctor just looking, but in numbers tell you, did the nerve get more damage in the past 6 months? Is your pressure lowered enough in order for us to prevent damage to your optic nerve?